Hi, in this video we'd like to answer one of the most common questions we get from pregnant women, which is bleeding during pregnancy. Is that normal? What does that mean? So bleeding during pregnancy is never normal. During a healthy pregnancy, you will actually experience very little to no bleeding at all. And if you do experience any amount of bleeding, it is a sign of a potential miscarriage about to happen. So these types of miscarriages, we classify them as threatened miscarriage, because they are threatening to happen, and then it gives you a small window of time to quickly take action and actually prevent this miscarriage from happening. So these types of pregnancy can be saved, although we cannot guarantee each threatened miscarriages can be saved. But in our history here at Antai Hospital, threatened miscarriages, as long as you come to your hospital, come to the doctor as soon as possible, as soon as you see the bleeding, usually it will be prevented, the pregnancy can be preserved. So the most common cause in Antai Hospital's history for threatened miscarriages, we see the two most common causes. For early pregnancies, which means within 12 weeks, when the pregnancy is still relatively young, the most common cause is one, either an immunological factor causing the implantation site to actually bleed, because these antibodies are actually attacking them. So this is the first cause. Second cause is a corpus luteum insufficiency. This means that the mother has an imbalance in progesterone. There's not enough progesterone, that means there is not proper implantation of pregnancy, causing this bleeding. So for the immunological factor, here at Antai Hospital we offer our patented immunotherapy. Just one injection, intravenous injection, 1 to 2 courses of treatment, and then we can already see the bleeding stop and then the pregnancy stabilize. Because this treatment is very effective and it deals with the root cause of neutralizing these antibodies. That's the most common form of threatened miscarriage that we see. The second one is the lack of progesterone. Treatment method is very simple. Once diagnosed properly, we only supplement however much the patient requires. Nothing more, nothing less. Because too much can cause complications, too little can also cause complications further down the line during pregnancy, during labor. So progesterone supplementation must be very accurate, and if done properly, pregnancy can be stabilized and can be preserved. So let me recap. For early pregnancies, it's immunological factor and a corpus luteum insufficiency. So if you experience any type of bleeding, don't take any risk. Quickly see your doctor and receive the proper management. So for late miscarriages, late pregnancies, threatened miscarriages do happen, although they are extremely rare, because in a late pregnancy, your pregnancy is considered to be much stable, much healthier. Very little can actually cause any disturbances. But if it does happen, then it's most likely that there's a premature dilation of the cervix. That means the baby is about to come up prematurely. This can actually cause fetal death, so massive internal bleeding, which will actually cause the symptom of vaginal bleeding and then also abdominal cramps. So during late pregnancy, this is much more critical, much more difficult situation, so you need to go to an actual specialist that knows what they are doing. So here at Antai Hospital, in late pregnancies, usually it's either caused by a short cervix, cervical insufficiencies, and depending on how advanced the pregnancy is, we may be able to actually do some surgical intervention and then secure some anti-cervical rings to prevent this premature dilation. And 80% of the time, we can actually preserve your pregnancies. But time is of the essence, so if you do experience any symptoms, bleeding, cramps that are happening far too often, abnormally, quickly go to your doctor. Time is of the essence, and then the pregnancy can be preserved. Antai Hospital offers our pregnancy preservation management with a full refund guarantee. Please visit our website and also leave me a comment down below.